Hello everyone, my name is Wanyoma the Gentle Dove. What I want to talk on is the work of a home caregiver in home health agency and the work of a nurse in home health care agency. Caregiver job is different from what a nurse is doing to the client. But sometimes some caregivers, they don't know that this is not their job and they are doing it, or a nurse will come in and tell you to do this for the client and you are doing it, but it's not your job. One, dressing a wound. Dressing a wound, when a client have a wound due to diabetes or whatever, is the work of a nurse to dress it. After cleaning it, they dress it and put, bandage or stuff like that. It's not the work of caregivers. But some caregivers, because when a nurse come in, we tell them, do this, clean it, remove this, put this, they are doing it. You have to tell them that I am not advised to do that. If not, you will be doing their work. Every morning you come, you will there and clean and dress. It's not the work of a homemaker. It's the work of a nurse. And another thing is prescribing medication is not for the caregiver. All the caregiver have to do is when client wants to take her medication, you can help her to bring it closer to her. If it's not closer to where the client is, then give them water, glass of water, and remind them, this is 10 o'clock, you have to take your medication. The one by 10, you remind them to take their medication. That is the job of a caregiver. Another one is using oil lift to lift a client. Is not the work of a caregiver, but some caregiver are doing it. It's a work of a CNA. It's a CNA that's supposed to use that, not a caregiver. But some caregiver are doing it because they don't know it's not their work. The client or the family member be telling you to be doing that. It's not your job. Another thing that is not the job of a caregiver is to help their elderly or their client to cut their nails. Cutting their nails is not your job as a caregiver. When they ask you to do that, advise them and tell them that is not your job. Taking care of client dog, shower the dog, do all those things. No. It's not your work. Your work is to take care of your client, not the dog. Because some of them will tell you to shower their dog, do this, food, clean the poo-poo for dog, all those things. Some caregivers are doing it, but it's not the work of the caregiver. So, and many other things that is not the work of caregiver. Your work is within the client's home. Client should not tell you to go and clean the snow. You are going there to clean the snow. Or client will tell you to, help her to paint her house, just little paint. You don't do that. Or client will ask you to cut glasses. Is there? I don't have anything you are doing today. I want you to cut my glasses. No, it's not your job. Tell them that you are not advised to do that. They can call your supervisor. So many work of a caregiver or homemaker is housework. That is your work. Other work that is, not a housework, tell the client or the senior that you are not advised to do that. Because some caregivers are doing the work of a CNA. Some even go further to do the work of a nurse without even knowing that it's not their job to do that. So please, I am explaining them in this video so that you as a homemaker or caregiver working for any home healthcare agency should know that this job is not your job. And some things you do for client, you have right to say no and you have right to say yes, but you have to let your supervisor know. My name is Nwanyoma the Gentle Dove. Thank you for watching my video. Thank you.